Welcome back. Recording from the intensive care unit. This is the 6th video out of 10 of COVID-19 series. Welcome to the Medicine Essentials. This video is about COVID-19 mortality and comorbidity. Mortality. The mortality rate is 6.6% around the world, but it depends on the country. Death percentage varies from less than 1% in Russia to 15.5% in United Kingdom. We really don't know yet why we observe this difference, but we will explain what are the risk factors.
Let's number risk factors for mortality. Many factors are associated with mortality. We list the most important of them. Older age greater than 60 years old. Male sex. Body mass index greater than 30 kilograms per square meter. Medical comorbidities. Chronic pulmonary diseases. Cardiovascular disease. Chronic kidney disease. Diabetes. Immunosuppressed. In a study assessing mortality, cardiovascular disease was more prevalent in patients who died, 13 of 68, than patients who survived, 0 of 82. Patients who have higher odds of in-hospital death are older age, D-dimer levels greater than 1 microgram per liter, and higher SOFA score on admission were associated with higher odds of in-hospital death. Additionally, elevated levels of blood interleukin-6, high-sensitivity cardiac troponin I, and lactate dehydrogenase and lymphopenia were more commonly seen in severe COVID-19 illness. Sustained viral detection in throat samples was observed in both survivors and non-survivors. In a study of patients admitted to the intensive care unit, mean age was 60 years. And the mortality rate was 62% by 28 days. The overall rate of comorbidities among the two groups of survivors was 20%, and for non-survivors was 53%, with cardiovascular disease 20% versus 53%, chronic cardiac disease 10% versus 9%, and cerebrovascular disease 0% versus 22%, accordingly. Most critical patients showed signs of organ function damage, including acute distress respiratory syndrome in 67%, acute kidney injury in 29%, cardiac injury in 23%, liver dysfunction in 29%, and pneumothorax in 2%. Cardiac injury was defined as an elevated serum level of high-sensitivity cardiac troponin I greater than the upper limit of the reference range, greater than 28 picograms per milliliter, which was increased in 15% of survivors and 28% of non-survivors. Comorbidity. In a study, comorbidities associated with severe illness and mortality had been identified, including hypertension presented in 48% of deaths, diabetes in 31% of the deceased, coronary heart disease in 24%. We have to add some pulmonary diseases, being the most prevalent chronic obstructive pulmonary disease. Chronic kidney disease can also predispose to a severe illness. Immunosuppression included oncologic treatment in the last year, steroid use, organ transplantation, human immunodeficiency virus infection, and acquired immune deficiency syndrome, leukemia/lymphoma, vasculitis, collagenopathies. Thanks for watching. Go to the next video now. COVID-19 severity categorization.